Barry, if you're ready, would you like to open the webinar for us, please?
Yeah, I could do that, and then the rest can join later. We have the RRT team that are in training as well as there's a delayed lunch, so they're here as well. So they're here to listen in. So welcome everyone. Thank you for joining this webinar on risk communication, and I think it should be, very interesting. We've now traveled to 6 provinces doing RRT, and I think there's a real need for increase in the risk communication part in delivering of the vaccine and making people to come forward and get the vaccination. Not only the general public, but also health workers to start off. So it'll be interesting to share information on experiences and what's happening in other parts of the country, and also our Solomon friends, the uptake of vaccine and the hesitancy part from I think more interest in the health workforce and also the public. So I welcome all of you on behalf of the FPT training program in PNG and also FPT training program in Solomons. So I officially open the webinar, and over to you.
Thank you, Barry, so much. Abel, are you on there? There you are. Over to you.
Thank you, Steph. Just ignore my background. I'm up and about, and you can see I'm sitting in my vehicle now, converting it to an office. But it's very nice to meet all the participants on this webinar, including our FET faculty, our friends across Solomons, and James and Tambri. It's good to see you, and Barry doing a great job, with this rapid response trainings in a couple of provinces now. So I think this webinar is very useful and very important, and I think timely, as Barry highlighted. Especially with this COVID pandemic, there is a lot of, say, information overload right at the moment, and it's also challenging for us as field epidemiologists and also healthcare workers to provide, convince, and also kind of provide the right information when the public already has a lot of information. So I think a lot of things we are kind of learning as we go along, and that's the reason why we have got, I think, 2 speakers on this call who will share their experiences, and I think we can kind of tell the story also that not everything is as it is in the books. Things are different based on the context, and so I think we'll be really looking forward to hear those stories, as well as from the discussions. I believe we can come up with some good ways to really engage with the community, and how to, as healthcare workers, how to kind of sell or kind of convey the correct information to the community to make informed decisions. So yeah, it's welcome on board, everyone, and looking forward to the presentations and discussions. Thank you.
Hi everyone.
Hi there, Marilyn. Everyone, this is Marilyn. She's one of our graduates from the program. She's working on research and policy in Bougainville, and she's had some really exciting and varied experience with risk communication during the pandemic response. So we're really glad to have you here today to share some of your stories. So thank you.
Thank you too.
So we're just going to have a bit of a chat to just talk through some of Marilyn's story from the past year or so through the response. So Marilyn, my understanding of watching a lot of the pandemic response, and particularly around prevention and control measures, I think we've seen globally that it's been so difficult with COVID because we're recommending isolation and physical distancing and things that are very complex to implement everywhere, but have been really complicated in PNG because this is not how culture is set up and how families and the economy is set up. And so it's been very difficult for people to do. for staying at home, not being able to go to the market, things like this. Could you share with everyone your lovely story about how some very young children set an example for everyone of how they can support people through a difficult time of isolating?
Thank you, Stephanie. And again, thank you everyone for this opportunity to share. Firstly, before going through the story, I just want to make acknowledgement of my team members that are currently now online. The AROB FLT alumni plus the RR team that we're working with. All those, I might say that these are not my stories, but it's our stories as a team in working with, especially with risk communication in Bougainville. So thank you so much. And also to my two mentors, Alois and Roslyn, thank you for this opportunity. So basically the story about the children that were, especially school-age children, very young ones. The challenge for us was how do we support families and friends, especially those that were in isolation. Like Stephanie introduced earlier on, we had there's so much going on that we tend to forget the basic needs that people were actually in need of, especially during that isolation period. So after realizing that there was a gap, we tried to find out how best we can support the families. And so we did a call out to the communities, the churches, the business houses, and even the schools. From all those call outs, we got a very few response, and one of those was interestingly, it was from a school, an early childhood school. And the children there and the teachers, they had to, they mobilized for some food supplies, and they sent talk surveys and appealed to their parents. And they came out with those little food supplies, which they gave to the team, especially the toiletries and the basic, the needs that families would need that would make them go out, especially to shops, and increases the risk of transmission again. So after that supplies were given, we were able to deliver them, but it happened that the foods were not delivered to the families, those that were in home isolation, but it was given to those that were in the acute care ward. It was actually a blessing in disguise at that time, because most the patients that were in the acute ward they didn't have a general food supply at the hospital first at that time. So that was something that really made the impact, especially on the patients.
Thank you, Marilyn. It's really nice to hear how even the youngest members of community can really be supporting people. Thank you. I wanted to touch a little bit on social media, and we know social media is so important in this pandemic response. We had 57% of people from more than 900 people surveyed say that they get their COVID vaccine information from social media. So it's a really, really big thing. But you also found that we can't just use social media, that there's a real need to continue using more traditional media. I was wondering if you could share a bit more about your experiences in traditional media in the response.
Thank you, Stephanie. So basically what we experienced in Bougainville, especially with the information dissemination using other platforms apart from the social media platform, was we realized that not all Bougainvilleans, especially those in the rural settings, were accessing information on these social platforms. So the challenge was, how do we disseminate those information to the other non-social media users? So we came out, when I say with a strategy to develop a information booth. The information booth was something that we couldn't do on our own. We wanted to do it on the main regional capital, which is Buka. And with the risk communication team and our response team were very small. We didn't have the capacity to do that. We had to make a call out to our partners, especially our local NGOs and our INGOs to assist us in that. We had a good response, so we set up the information booth in the regional capital, which is Buka. We did that and we tried it out for a 2 weeks period. We didn't have a specific target group, but we had the general population, especially those that were literate and were able to process the information that were given, especially students, school teachers, and all these all those NGOs, to name a few, we like Care Plan, Save the Children, Red Cross, ICRC, and our local NGO, our women's group, that was Bougainville Women's Federation. They were there manning the stall 24, during the day. In the night, they provided a bit of security to the stalls, to the boards. And most of the information that were delivered include preventative messages, statistical updates, quarantine, stigma, discrimination messages. We also saw the need to address other issues like gender issues, other social issues, economical issues that were also happening on that time. So the board was basically an information for all the general public, the commuters to the town, because it was the central hub where everyone come in on daily basis and access the services there. So we had a good outcome. We distributed about 10,000 plus IEC materials in that stall. We reached out from head count. We had around 5,000 to 6,000 people that were visiting the information booth on during the 2 weeks. One of the other activities also that we included in the booth was hosting Q&A, question and answer, where public and not only the health experts were invited, but also the pandemic controller, government officials. So the public had time to, ask those concerns and get back the response from these relevant authorities. So after the 2 weeks ended, when we did a review, just a quick public review on that booth with our partners, we found out that there was a general concern that such initiatives should be moved out to the districts as well. So we worked on that, and we moved the booth. We made it a mobile booth, and again, with the support for our ICRC and Red Cross team, we were able to deliver those key messages on a mobile booth down to the 13 districts.
Thank you, Marilyn. And can I ask you to explain a little bit of what does that look like? So making this mobile booth go to the districts, is that you're on the back of a truck with a...
It was basically, yes. Yes, exactly, something like that. And with our volunteers on top, during the day, there were specific locations, like they go to the community government halls and they do trainings for the community government. And later on, they pick on a specific sites for public awareness. So it was basically a bit of training and also community awareness as well.
Fantastic. And what were the main kinds of questions that people were asking at the information booth?
Oh, thank you, Stephanie. It was interesting, people were, basically what we found out was not so much of the health questions. People were asking about those social issues, like what can the government do for me now? How do I access those services? Basically, most of them were the other concerns. The social issues were the ones, and the economical issues that people were currently facing. So it was not so much on the clinical questioning that were coming up, but yeah, more into the social aspect of it.
Thank you. Could you share a little bit more about what it looks like to be working with the social mobilizers that already exist in your community? So you told me about putting up posters and shops and things like that. So working with your existing networks that are there.
Thank you. So we have a group that is also already part of the Department of Health, which most of our mobilizers come from. That is the Bougainville Healthy Community Program. And this is where all the social mobilizers, or we call them here village health volunteers, which are basically, they are used to assist in delivering those key messages. They are also used to, they assist to mobilize communities, give out those key messages, and also participate in such of this community awareness as well.
And are these community social mobilizers, are they all over PNG, or is this just in certain parts?
Okay, for Bougainville, for the Bougainville Healthy Community is across Bougainville. So they have all mobilizers across the 13 districts. They have it down to the facility and down to the community level. So each facility has more, I wouldn't give a specific number, but it has more than one mobilizer for its facilities and communities within that catchment.
Thank you. I'd be interested to hear later in the discussion section of what what that looks like in other parts of PNG as well. Marilyn, I was just wondering if you could share finally about your personal experience with COVID and how that has impacted the way that you approach risk communication with community.
Thank you, Stephanie. So, like, one of my experience that when I was in isolation with my family, and also with those friends and families that are currently in isolation, the lesson learned from this was, our family, like you mentioned earlier on, in PNG, it's a typical Bougainville family, not PNG, but Bougainville comprises it's not just a nuclear family, it's an extended family. You have Bubus, Bubu Mary, auntie, uncle, all living under the same roof. So when you talk about social distancing, it's something that to us, it's a foreign concept, right? So we were trying to preach something and we were trying to introduce a culture that is not even part of us. So when I was with my experience, I felt that, instead of talking about social distancing, we should be talking about embracing family, the dynamics that we're in. We should be talking about infection prevention control, how we can have mothers and women and children be the role models of IPC in their homes, not inside the health facility, but also in a non-healthcare setting. Instead of talking about, wearing a mask, or let's talk about hygiene practices. Let's talk about water and sanitation. Let's also talk about the gender roles. One of the things that I had from my experience was, in those messages that we were giving out, we didn't include the gender roles and responsibilities, especially in times of isolation. But my experience taught me that when it comes to actually delivering those, when you're in isolation, you would know exactly that most of these roles are often given to the mothers, to be the caregivers, to be the IPC nurse, to be all of the above. And so I feel that there is a gap right there. For us health workers, we know exactly what to do. But for a non-health worker or an ordinary mother in the rural village, basically she wouldn't have those skills or knowledge on how to best care for the family during that time. So, and not only that, parents and family members should learn to how to share those roles and responsibilities as well. So if we are focusing the message only to the mothers, we increase that gender gap in which people will feel that it's the role of the mother. But we should be encouraging more that, mothers and fathers take the equal responsibility when it comes to treating or dealing with patients or people during this COVID-19 response, or even in isolation as well. So my experience has taught me a lot, and I feel that going forward, some of those messaging, we should be including them as well in the risk communication materials that we're giving out.
Thank you, Marilyn. I think that's so important, and something that globally is being recognized through COVID as being a big issue or a big gap is just how women are affected differently in this kind of scenario. So it'll be really interesting to maybe discuss that after this, moving ahead, of what it could look like to support women in these particular roles during emergencies like this. It's really important. Thank you, Marilyn. Pele, how are you going over there with your presentation?
So send it through to, yeah, but then she didn't get it. So
I have it here, so I will do this. How is that? Is that full screen?
Yes.
Yes.
Perfect. Pele, if you just tell me when you want me to go to the next slide, I'll do that for you.
Thank you. Thank you so much for giving us this opportunity. So with me, I have my little team. It's actually called Abruzim COVID-19. And Lisa is the one that's leading us with the Abruzim COVID-19. So here in Papua New Guinea, it's me, Carrie Ann, and Duk Duk, and our support team from Bernard. So yeah, please. Next slide. So as you can imagine, in 2019 was the first COVID-19 news. And then in 2020, we had the first lockdown. And we had a lot, before the actual lockdown happened, before we had the first case, there was a lot of talk already on COVID-19. And there was a lot of misconceptions, and the main talks were that the COVID-19 was actually a scam. Now in East New Britain, we had a lot of misconception that went through WhatsApp, that went through Facebook, the other social medias. YouTube was one of them, and there was a lot. And we had to, come up with something concrete in order to help us to find a way out to address the misconception that was happening throughout the province. So we had this group, the Abruzim COVID-19 group under Bernard, that actually worked in collaboration with the PHA, and that was actually to help do the community engagement throughout East New Britain. And before we actually did that, we had this continuous dialogue meetings, and we came up with messages that would suit the context here in East New Britain. It was a provincial thing, so we decided to have something, messages that were actually understood by everyone in the province. And so that's where PHA, Abruzim COVID-19 Bernard, developed all those materials to start the display. Please, next slide. And then because we had a lot of, you know, every month, not every month, but every week, we had a lot of different messages that were coming. These messages were actually impacting on our messages that we have developed. So every now and then we had to put out messages. So in that messages that we developed, we had a poster, we had a flip chart, we had a little booklet, and also we developed radio messages and text messages for phones. Now, in those messages, in the posters, we had around 13, 14 messages, and these messages were actually different, 18 messages, and they were actually different. And this was actually to be able to, you know, at certain stages, we had to change those messages. So that message from the beginning, we had the basic facts about COVID-19, and as we go by, the messages changes, the misconceptions changes, and therefore we had to change our messages too. So that's how we had those, you know, trying to address the many misconceptions that were coming through every day. Thank you. Next slide, please. And therefore, I will say, many of us went through the fear, and even the fear we had also came discrimination and stigma, and there was a lot of mistrust as well. And the mistrust was actually other health workers say they might infect us again, and therefore we had a lot of people that were sick that were just at home, not wanting to seek medical help because of greater fear of COVID-19. And that was because we had all those misconceptions, and we couldn't address it right on the spot. When it came, it hit us real bad that we were not prepared for it. And so many people registered that in their minds that this was true. Whatever that was coming up later wasn't true. And I can understand now, because of that, there's so many people that are still hesitant to take to get vaccinated because of those fears. And I'll say I had that as well. I had a lot of fear. When I had some signs and symptoms of cough and chest pains mainly, no fever, but I went through the cough drives and I went straight to the testing place, got the swab. Now it's a protocol that after you're being swabbed, you will stay at home and wait for your result, and you'll be isolated for 2 weeks. Now I stayed at home waiting anxiously, and during that time, I'll say I had a lot of fears because already I registered that this was the correct information. But after I went through all these informations together, developing all these IEC materials, it became clearer, but I still have those fears, I will say. And that's the reality of misconceptions and informations being put into different platforms that's disseminated to the communities and public. Yeah, please, next slide. And so these were the materials that we developed, and we tried to address the misconceptions. Now you will see we had the COVID-19 information booklet. Now this is a very small size. It's a pocket size, and it will actually fit the palm of your hand, and you can carry it around. And then we had we developed also the posters. Now the flip chart and the flip chart guide, plus the resource guide for trainers, was actually developed to do the community engagement for leaders, TOT for leaders. And that is actually to help us carry out community engagement at their communities. Now, with the activities, as I said, this was PHA in collaboration with Bernard. We came up with two main activities for the community engagement, and one was actually to just do general awareness, and that's what we did. We put up posters at the busiest public areas. And that was WHO posters and our local developed posters. And then we gave out information papers, and we did community engagement at the schools, since the schools were the best people to get to the communities, to their parents, those who were just at home, who didn't have access to those social medias, didn't have access to phones or radio. These students actually went back and, you know, helped us to do awareness at their own little homes. And so, next slide, please. With the work that we did, we had we did the first community engagement. That's the distribution of IEC materials, and then the second one was actually we selected LLGs, and then from LLGs they selected their through the WDC. That's the Ward Development committees, and in the WDC they had these leaders called the health chairman in the communities. So this health chairman plus the leaders, we had to train them. This training was actually taking them through the resource guide, how to plan their activities based on the messages, and not only on COVID-19, but also looking at other diseases like diarrhea, malaria, all that can also affect communities. And this actually led to us having the Healthy Island concept in the resource guide. And that's where people saw their ownership of localized informations. And they took it up and they helped us because they saw that, oh yeah, this is from our own people, East New Britain, and we had the logos for the Bernard and the provincial health authority or the provincial government. And that actually made people to realize that this is our own, and they decided to take that ownership and, you know, help us to build from there. Next slide, please. And in those IEC materials, as I said, we have all those topics there, but it would be good if I could just display the different IEC materials that we developed and distributed. This next slide, sorry. And there, as you can see, we had different messages at different points. The first ones we had it up was actually about COVID-19, and then the next one we had about signs and symptoms. And this was actually also translated to Pidgin. So we had the English and we had the Pidgin. So when we were giving them out, we asked them, would you like to read in Pidgin or English? They would get whatever that suits them. So that was the best thing about it. And we were able to distribute everything that we had. So as time passed on, we had to change our messages again. Please, next slide. And this is where we had the flip chart. Now the flip chart was actually a tool that could be used not only by community leaders, but also by health workers. And this is how the flip chart looks. And it had all the information that one person could have to tell to the communities as well, to share with communities. It had everything that can be able to help address the misconceptions and iron it out. So that was the bonus on the flip chart that we had. And many of our leaders were actually happy with it. They loved it because then they had a tool. Now in the tool, I forgot to mention that when we were developing these tools, we decided to have it as a pack. So in a pack, there is this booklet, COVID-19 booklet, we had a flip chart, guide, and we had the resource guide book that a community leader or health worker can actually use to do community engagement. So please, next slide. Yes, so as I said, things, as messages change, we change our messages too, and that was something that we did. Please, next slide. And this is how the next lot of messages looked like. After the first impact, we came, and when there was less attacks on it, we had all these other messages that came about that we had to put up on notice boards, give it out to schools, and give it out to the communities. So yes, please, next slide. And when people started getting sick with it, that's when our message changed to the vaccine. Please, next. And we had to continue with the avenues on social distancing, taking care of the sick, taking care of the health workers, supporting the health workers. And this is where, because we had a lot of messages, you know, the second slide that we presented was on stigma and discrimination and denial and mistrust. This is where these things, this next lot of messages became handy to the communities and to us as well. Next slide, please. And so when we had the first messages that came out about COVID-19, now this was a blast because it was a challenge for us, because then we had a lot of questions that came about, like, why so soon and so quickly? How did they do this? How did they quickly come up with a vaccine and it's not real? And all that fear and all that talk about blood clotting, it will kill you, it will kill you in days, all these messages that came was actually something that we had to put up with. And to me, honestly, I had that fear as well. But then, if I keep on holding back, how will I know if it works or no? So I had to get up, move and go and get myself vaccinated in order to feel and to know and to be able to talk to others about it, to be, as I used to say, a living testimony to others and say, look, I did feel this, but then it went away after a day. And that's the kind of thing that we would like to, you know, share for others to see and say, yes, it's actually working. And this is where I can say the fear is still there, and there is a lot of vaccine hesitancy at the moment because of those fears that were pulled out or were actually displayed on social media, was spread out, and how we register it in our mind is actually different. No one can understand how individuals think. So today it's still a fear, but at least we are getting through that. We're getting through that, and we're breaking the ice there to get people to be vaccinated, because we had to step up and say, since we are the community engagement team, we have to be the first people to get it and show them that this is actually working. Please, next slide, sorry. And this is where we developed the next lot of slides, and thanks to the graphics people who did that so well. And the COVID-19 vaccine posters, we had that. We had a small booklet as well. This, maybe it's in the next slide, I think. So these are the posters. It's actually only 3 posters. We don't want to make it like too many messages and confuse people. So we had to stick to only 3 messages that were acceptable to the communities. And this is how the flip chart looks like, and a little information booklet right on the right-hand side. COVID-19 vaccine information booklet, and that's a small size booklet, and that's how the flip chart looks like. And that can go in with the pack that we've been giving out to the community leaders to do awareness at the communities. So yes, please, next one. And an acknowledgement, I would like to say thank you to the East New Britain government and also PHA and to our team. And of course, we've put in the Adley Supsup and Pascalis Kinakawa, who are from the PHA, who have been working very closely with us to develop all these messages for communities in East New Britain. So the messages that were developed as well was actually according to our own context. The way we speak our Pidgin won't be the same as the way Madang people speak their Pidgin or Islands people speak their Pidgin. It's going to be completely different. So that's why we develop those messages according to how we understand it as, say, locals. So thank you so much for that. And if I could just show you the, Lisa, if you have it, can you show the information guide for us? Not the resource guide, please. I just want to show what's inside that resource guide, because that was the guide that we used to show the leaders on how to use the flip chart, on how to say, do the awareness. Yes. So if you can just scroll down to the context, right down. There you are. So if you can just see, we have the New Palapasin title there, that's number 1. Now under that, you will see we have the response to the current coronavirus situation. It has everything inside the resource guide and all the activities, what to do, how to say things. And then we have the risk communication, which is very, very important. And risk communication is actually one of it that we had to talk to them. How will they respond to sudden outbreaks, sudden pandemics? And then we have the social stigma. And this is where we got one officer, the coordinator from the GASI, who actually helped us to, her name is Geraldine Wambo, and she actually helped us with it. She was actually with us throughout the trips that we were going training leaders. So she was the one who talked mainly on the social stigma and discrimination. Now we have the Healthy Island concept in there that we got these district health coordinators to help us with, but they just introduced it, and Adley Supsup actually ran through the Healthy Island concept. Now this is where this Healthy Island concept is very, very important, because it will address what is coronavirus, all the other diarrheal diseases, malaria, all that, you know, having prevention measures is better than trying to run to an hospital to get treated when you're already infected. So the Healthy Island concept was something that made a blast in there, because then once we had this Healthy Island concept, we had all the what is coronavirus, everything came and it just flowed through with it. Now you will see under the planning and action plan, this is where leaders, we all sit together and plan, map out their activities, what they want to do, where they're going to go, who are the first people, contact point for them to do awareness with. So this resource guide was actually very helpful, because then we display it and they use it. But we are yet to see. Maybe the PHA team has seen one, but not us. We are yet to see one, so that we can be able to witness the use of the resource guide. So yeah, thank you so much for that. I think I took a long time to say everything. Yeah, thank you, staff.
Thank you so much, Pele. That was so interesting. I'm already getting messages from people in the chat asking if they can see more of these resources. So Obviously, this is something that would be really helpful to a lot of people in the field.
Thank you.
Are there any questions for either of our speakers?
Hi, Gilbert here.
Hi, Dr. Gilbert.
Sorry, I came a bit late. I was caught up and then tried to get logged in to the Zoom, but I think from what I just got from the last bit, I want to congratulate for all of you for excellent work. I think the huge challenge we have in our communities, I'm happy to see that you got community participation and community leaders' involvement is paramount important for the message to grind home to everyone in the community. As all of us know, because of COVID-19, social stigma is one of the biggest challenges. Can you hear me?
Yes.
Because social stigma is one of the huge challenges in implementing the program, particularly when it comes to people who become positive. And we're trying to, as you know, most of the health facilities do not have facility to isolate. So there's an option available for those who do not develop symptoms at all, who are positive. There are also options to isolate at home or in a place where, they have to with their family. And it's a huge challenge. And with the communication information like this, it is a very good tool to educate our community leaders, put the paramount important, and also family members. And I hope our PHA can take on board and provide a tool to the health workers and also whoever needs that, only not health workers, but particularly yourself, provide other NGOs who are around who could facilitate that process of moving these messages down. And I think it's a great effort, and I want to congratulate those of you who put this effort into it.
Thank you, Dr. Gilbert. Are there any other questions from across the participants?
So, Steph.
Yeah.
So I just want to say it was a huge thing for us, because then PHA was actually on board throughout the process, and that was the greatest thing, seeing that from PHA. So we had a good collaboration with them. We had to, help each other get up on top of things and move forward, which was great. And they would check on us, we would check on them, and that was the greatest thing, getting that ownership and, trying to tell people that this is what we want, a normal life again. And I would like to say thank you so much to our PHA, because they saw that it was very, very important, and therefore they were there supporting us throughout the process of developing the IC materials and doing the community engagement. So yeah, thank you.
Thank you, Pele. We've just seen from Lisa in the chat that they're happy to share the IEC materials with everyone, which is wonderful. Thank you to the Burnett team. Over to you, Abel.
Very nice presentations. I think it's really interesting to hear from some local work. As I mentioned at the beginning, that you don't see this kind of strategies in the books, and so I think this is a new kind of development, and I think it's good to share between our network and also between PHA some success stories. Usually, building trust to engage with the community is just not that easy, especially when you have a pandemic of misinformation, so to speak. But I think Marilyn's experience. I think Alois and Roslyn, you're doing a good job in also mentoring your young upcoming team, and it's the stories like this actually kind of impress us, and we're really happy. And I think the strategies that you've used to engage with the community, and like with Pele's experience, where you're listening to what's being shared and dissecting that, and actually presenting the visuals in an appropriate way that the locals can make a good decision. You know, it's not only technical skills that's needed here, but it can, I mean, you can see very clearly that they use, you know, somebody with the design skills. And then it's more of a lot of people skills that has been used across all these engagements, and, you know, very successful kind of a story. And I guess the team would be looking at, you know, how to share this across, maybe sharing this video. So maybe putting in a format that, you know, others can share these experiences. Also, I just want to say thank you for those two presenters.
Thank you.
If there's, is there a question? Sorry. Are there any questions from anybody? I've got something. Great, people, thank you, James. People are after the resources, which is exciting. I know we're at time. I just want one last question, because one of the things that recently came through the vaccine hesitancy study that the team conducted in PNG, so more than 100 people responded, and I wrote it down, I think it was 45% of people wanted stories of people who'd received their vaccine, so what their experience was. Marilyn and Pele both have received their vaccine. So I was wondering if you could both just give us some tips on how to share our vaccine story with our friends in our community.
Hi, Pele, if I may go first. Thank you. So basically, that is what we're trying to do now in terms of sharing those vaccine experience, and especially for those that have already taken the vaccine. Just yesterday, we posted on our response group for anyone who volunteers to share their stories, to especially in those frontliner categories, to come forward and share their vaccine stories as well. Bougainville, we also had a very late launching for the COVAX program. It is scheduled for tomorrow. We're trying as well to do a public testimony for those vaccine champions, those that have received, and also those that are yet to receive them during the launching as well. So there's some of the methods, strategies that we want to use.
Thank you, Marilyn. Pele or your team, do you have any ideas of how we can practically share our vaccine stories?
So yeah, you know, actually getting your vaccine and being able to share that, was the first thing they would ask was, well, when I went and got mine, nobody knew about it. I just got it, came back home, and I said, yeah, I got my vaccine today. And when they saw the post, the Bernard post, everyone ran to me and said, how does it feel? Are you okay? You know, all that type of, you know, curiosity, trying to work out, is she okay? Is everything okay? And I had to say, you know, being the first person to share that was with mine. So my partner was actually not impressed with me, but he got up and said, what will happen to you tomorrow? And I said, I'll be alive tomorrow. Watch me, I'll wake up in the morning. And I got up, but even though I had that, I had to tell him that this is how it feels right now. And it's all good, it's fine. A mild, say, headache, tiredness, body aches a little bit. And that's the kind of story people would like to hear from your experience. And that's when they will say, okay, she's fine. I can get vaccinated. So, you know, getting vaccinated and then telling your story of your feelings, it's all good. They're gonna buy it. Yeah. Thank you.
Stephanie, Pele, if I might add to that, one of the most effective method of sharing your story would be through your family members. On my side, it was quite a different experience. My advocacy with my spouse was so positive that we took the vaccine together on that day. So I'm very much recommending that we start advocacy within our families, and yeah, going out as well would be a good, telling those stories within and then going out to the extended or outside communities. Thank you.
I totally agree with that. And also being a frontliner in your own office as well. And I'll say, not everyone is convinced still, I'll say, until someone in the office will have to get it and get vaccinated, and others will see, other staffs will see, and they'll go in. Yeah, that's the greatest thing about, being the one vaccinated and you're telling the story. Because then they come back to you again and ask, is everything okay? Like I said, this was but I did experience that within our office as well. How did it feel? All that. So, we can say we are medical people, we are researchers, but we have fears, real fears. And it will take a while since we got the first information, misconceptions at the first stage. That is actually registered in our minds. And that will take a while for one person to buy in for something new. So yeah, it's a good experience. Thank you.
Thank you both. I think you both just highlighted the importance of remembering just the very human aspect of this pandemic, and that it's important to always remember that we're dealing with people and people are concerned, and putting people at the center of our messaging is important, and you both do that really, really well. So thank you so much, both of you, for sharing your experience and your strategies. Going to hand over to Abel to close. If you're on there, Abel.
Yes, I'm here. Thank you so much, everyone, for participating on this webinar. I think we've gone a little bit over time, but this is important and critical to the current response. Understanding, our community, and I think, both experiences that Marilyn and Pelle shared from our local communities, and you can see the importance of understanding the local context and actually working with the community, collaborating with them to successfully, present the information to people to make informed decisions. So we can learn from both presenters that I think, technical experience is one thing, but I think knowing the community and those very small people skills, so to speak, like empathy, love, care, which we have seen in Marilyn's experience as well, the children coming out and saying that, we want to help. I think that does not come very easy unless you engage with them very well and present your message very well. They're able to come. And I think this also kind of tell us that, we need to have those additional people skills to kind of reach out to the community to understand their needs and understand the challenges they're currently faced with, and then able to convince them by sharing the correct information. So I think thank you so much for sharing those skills and experience with us. And definitely, rest of the team, if you have any additional questions, we will try and make available Marilyn and Pelle's contact details, or otherwise you can reach out to myself or staff, so we can always get in touch with them to, answer to any questions that you may have. But again, thank you so much, everyone, for being on this call, and we're looking forward to more discussions in the near future. And if you have any questions as well, we will be really happy to respond to you. So please do not hesitate to ask. From me, thank you for participating. Back to you.
Thank you, everybody, very much. The Burnett team have kindly said that they will share their resources. So we will put them together along with the link to be able to find the recording of this if you'd like to watch it again, and I'll send that out in an email to everybody then. Thank you so much. Thank you to Pele and Marilyn and the team. Thank you. Thank you to everyone for joining.
Thank you.
Lovely to see you.
Bye-bye.
Very much. Bye-bye.
Thanks. Bye.
Thank you.